We have a very special person, of course, Therese Johnson of Senior Care of Sacramento. Therese, how are you?
Hey, Jim, good. And I enjoyed the My Music song, the diabetes song, too. That was awesome.
Yeah, it's pretty incredible. And I know today, as we go ahead and think about the use, the hip hop, the rap, and we have people that we know that are getting older. And I'm very excited about what you're going to be talking about, just the benefits of working with your loved one, especially if they're older, and the importance of having the right direction through geriatric care and advice. I know you're going to be talking about that. And if you can go ahead and just give us a little more specifics and what you want us to know about having somebody that really understands how to guide us in helping people that are seniors. Therese.
Yeah, I just wanted to give some of the benefits and talk about how geriatric care management pays for itself. So some of the things are we offer a better quality of life for your loved one, because if your loved one's life is better, then your life is going to be better too. You'll sleep better knowing that your parents are cared for properly, and having someone to consult with to know that you're making the right decisions is usually really helpful in making you feel more confident about your decisions for your loved one. We can help reduce risks by eliminating medication hazards. We can uncover hidden problems, unsafe hazards in the home, eating issues, medication errors. We can uncover unused benefits to help with the finances for financing care, such as Medi-Cal and supplemental and prescription insurances, Veterans Administration benefits. So we also can be your eyes and ears for out-of-town family members. We advocate for them so we can keep your family apprised of the situation. If you're not living in the same area as your parents, we save money. We're able to reduce unnecessary services, like if there's overlapping caregiver shifts or doctor's exams, for example. And we're neutral, so sometimes if family members need an unbiased voice, we can provide that for the family. So we let you be children and let you focus on your work. And that way we can handle crises and solve problems, so you can be the loving sons and daughters that you are, and maybe even take a vacation or have a day off. So let the job get done right the first time, and it's better to put your money toward people who are experts in care management, and that's what we do.
When is a good time to get involved and find out this information with a geriatric case manager? When is a good time, or care manager? When's a good time to connect with them?
Well, like you said, and we were talking about last week, planning is crucial. So any time is a good time when you're putting together your financial care plan, and especially when you're doing your power of attorney or that kind of thing, and your advanced healthcare directives. That's when you want to be looking at maybe, or if your family member is diagnosed with a chronic illness, that's also a good time. Anytime that things change in the environment or the situation or the finances, you want to reevaluate and update. And we create long-term care plans for people that encompass their budget, their environment, their location, and their health conditions. So pretty much, and especially for like about the time you're going to retire or before that, just before that maybe, I would say that would be an ideal time to create a long-term care plan with your budget and your finances especially.
And what would happen, like a lot of people, as we're running through life, like some people forget even the basics of paying themselves first, or even saving or investing their money. They spend it, and then later they find out, wow, I really don't have enough money to live on. What is the cost to you if you don't get that information ahead of time?
Well, it's like you said, the better you plan, the more choices you have. The less you plan, the less choices you have. And if you have no money, then the choices are made for you. So it's the same with healthcare, and when you need caregiving services, it's going to boil down to that almighty dollar, unfortunately, and your choices. When
you work with people, just a last question, I know you've worked with hundreds and hundreds of people and families. So when they visit with you, when they talk with you, what do they leave with? What experience or feeling do they leave with when they get the information they need?
They leave with knowing that they've looked at all their options, all their choices. They're aware of what resources are available to them, what they are and which ones they're eligible for, and they leave feeling confident that they know how to make a plan. Either they know what the future holds for them, what they have to do differently to make it better, or what is available to them in the moment in that current time frame, and what they can do. So they leave feeling confident they can make an informed decision.
Great. And I think you said the key word, an informed decision. And it's better definitely to plan before a situation happens, because then you're kind of reacting rather than really responding. So thank you so much for Therese, just for being with us today. And I know tomorrow you're going to be speaking a little bit in our section on finance and romance. And I think that's going to be very exciting as well, Therese, just with what you do for the community at hand. And, I know tomorrow we're going to be featuring you on a section dealing with that, because just money drives everything. And if you don't have the right things in place, that could be something that definitely gets involved and really affects your personal life as well. But we're going to have a lot of fun tomorrow, and we look forward to having you back. And this is Therese Johnson with Senior Care of Sacramento. You can go ahead and find her again at seniorcareofsacramento.com.
Ask for help. You're not alone. We can help. We can give you a peace of mind. We care. Saving seniors, savings.
Well, we help seniors find caregiving services for in-home, board and care, or assisted living in the geographical location they're looking for, in the budget that they have, and based on their needs, if they have dementia, if they're diabetic, or if they just need housekeeping or medication management.
Savings.
Contact us at seniorcareofsacramento.com.